Excellent.
Our guest today is Chuck Slonim. I think everybody here knows Chuck very well. Chuck is still in practice at the VA, is one of the leading ophthalmologists and surgeons in the area. And Chuck has been with the Lightning since the beginning, since '93. So he goes all the way back, and I'm hoping that he'll give us some insight and some interesting stories, maybe some of his encounters with Phil, which are always interesting, and some of the things that go on that we don't get to see or hear on TV, which I'd like to know about. How they conceal injuries, how guys can get teeth knocked out, get stitches, and come back in 4 minutes is always fun to hear about. And Chuck, I'll let you take it from here and tell us what's been going on in your life.
Sure. Thank you all. Thanks, Dave. It's nice seeing you all. It's great, and especially on a Zoom. I'm so used to Zoom now. It's almost like a regular meeting doesn't go over well. No, I've been with the Lightning. I'm the only doc that's been with them all 30 years now, starting the new season. There's only 4 of us that have done that. One is a dentist. One is an equipment manager for the opposing team, and the other is the video coach, Nigel. And so those are the only 4 of us that have been with the team since its inception in 91 and 92 season. So I've seen everything. It's sort of interesting. Dave asked me to throw some slides there, and so I did. And it's like, when your dad put these 35 millimeter slides together and said this was our vacation, and you're going to be bored to death. But then at the end, I'll answer your questions about then some of the things that Dave was talking about. My voice isn't back yet. On my birthday on July 25th. I tested positive for COVID as certainly the most compulsive person. I was certainly the most compulsive person there is when it came to not going out with friends, not going into restaurants, anything like that. I went to the Ascaris meeting, which is an ophthalmology meeting in Las Vegas because I had some business there. And it was the first time I went into any restaurant to speak to some pharmaceutical CEOs. And a few days later, more than maybe 4 or 5 days later, I was positive for COVID. So I just got off my 10-day quarantine. So if I'm still short in voice, that's part of the reason. And there's still some other things that I'm not sure about if it was post-COVID or not. But anyway, that being said, I'm chief of the ophthalmology over here at the VA, still full-time, still help the residents every other night in Tampa General doing their oculoplastics, which is my subspecialty. And so I only work over at Tampa General between 10 at night and 6 in the morning because that's the only time I have to go help the residents. Be that as it may, that's enough about me. Let me share a screen and send a couple pictures over to you. Hopefully that will be yes. Hopefully you're seeing it. Maybe it's on your screens, but again, it's just a picture show that I thought I'd go over, and then I'll tell you some of the idiosyncrasies and maybe take up the next 20 minutes, 30 minutes of your time and maybe answer most of the questions. But yeah, I was able to drink from the cup. I was able to drink both beer and champagne at the 2004 locker room. This year's locker room, I did not because of COVID. I didn't want to take my mask off. There were other family members that they allowed in. And there was, even though the team, before every home game, I had to be COVID tested 24 hours ahead of time. I did not trust any of the family members. And then I had learned that some others turned positive during that. I wasn't one of them. I didn't get it during that time period, but it did bother, it just stayed that way. From the 2000 2004 Stanley Cup, I just a few of the pictures. I don't know if you can see my pointer. There I am sitting there on the ice when they finally brought the cup onto the ice, and of course we beat Calgary for that. But you can see having the opportunity, that was more of a thrill for me. It's a big ego trip, and it's just something that anybody that's in sports medicine, always wants to have that opportunity to be at one of the championship trophy episodes, if you will. I think I'm over here just sort of waiting while the cup is here when they're introducing the captain that's going to come and grab the cup. And of course, the fans in the stands, as you can see across there. Again, just very something that you just never forget. My daughter in the forefront here, Marty St. Louis, and of course, Dave Anderchuk in the locker room afterwards. This is when I'm wet with champagne, and it's not sweat. It's just that champagne is thrown everywhere that you can imagine, and you manage to get wet while you're there. Some of the other docs Le Cavalier, of course, and with the cigars, and this is what happens in the locker room. Get a chance to hoist the cup, and they only allow certain people to hoist the cup. The docs, the staff can do it, the team members can, but family members and others cannot. And the keeper of the cup that travels with it has to stay with the cup and actually watches out for it to make sure that the only people that hoist it are those that are allowed to hoist it. And an interesting story, and hopefully the stories are interesting. I took the cup when they gave it to me for 24 hours, which is unusual for a doc to get it after the 2004. But again, I was with the team the whole time. And so I shared it with the other docs, and I took it to one of the docs' offices, one of the oral surgeons. And the cup was on a table, and I was talking to one of the the keeper of the cup at the time was Mike Ford, and he was standing in front of me, and I was sitting against a wall. I guess there was a window behind me, and we were just talking, and we were having a conversation. And during the conversation, he jumps up, runs over to the cup, which is to our left, and just tells the person, "No, I'm sorry, you can't lift it." And he put it down, or he didn't. He never grabbed it. He never lifted it, and he walked away from it. And then he came back to me. I said, "How did you see that somebody was lifting the cup, etc.?" He says, "Oh," he told me that behind me is a window, and he was looking at the reflection of the cup in the window while he was talking to me. So they keep their eye on it. It's a serious business, and of course, it's the most coveted of trophies because it does get around. It goes everywhere. It goes all over the world. Wherever the player wants it, that's where it ends up for those 24 or 48 hours that they take it, or travel internationally if they want to take it to their home city. I got to take it home, and of course, my daughters got to be with the cup, as you can see there, and they got to drink chocolate milk out of the cup. I had to hoist it to them because they can't hoist it, but I could lift it as they drank chocolate milk. Arlie was 13, and Emma was 11.
So is the keeper? And you said his
he's
name.
He's
in the house.
He is in the house while it's there.
So he stays overnight.
Yes, and if a team member wants it overnight, he has to make arrangements for them to be in a room somewhere, not necessarily in the bedroom, but somewhere in the house where the cup is. Keeper doesn't leave the side of the cup.
Isn't his name? I met him. Isn't his name Mike Bolt?
There's a Mike Ford. There's a Phil. There's really 3 keepers that travel from Toronto, where the cups are kept in the Hall of Fame. So there's a few of them that travel with it.
I think when the guy was here in 2004, his name was actually Mike Bolt.
Bolt is one of the he's it's not the keeper. It was
this guy with the floppy white.
Right
hair.
And Phil also has floppy white hair, but for the most part, these are just people that travel with the cup. And they, like I said, this is the family. As I took the cup to the University Club downtown, where I had a party where all the doctors invited a certain number of people, and were able to go to the cup. Interesting about the cup, I was asking one of the keepers, Phil, as a matter of fact, what's different when you have it up in Canada and when you have it in the United States? And as it turns out, in these parties, he says most of the U.S. people, they'll go up to the cup, they'll look at it for briefly, take a picture with it, and walk away. But in Canada, or if you're Canadian, you will read the cup, you'll study the cup, you know some of the history of the names that are on the cup and some of the X's where names were crossed out because they weren't supposed to be on the cup. And in all of those instances, they know everything about it. There's a history to it. They may or may not take a picture of it. They won't touch it if their team that they root for is not on it. It's just part of the protocol. And when we took this to the university club upstairs, I was watching some of my friends that are Canadian that I knew were Canadian, and sure enough, that was absolutely true. I would see the Americans just walk up to the cup, just quickly take a picture. I got my picture with the cup and walk away. The Canadians studied the cup. They read it, they studied it, they looked at it. They may or may not take a picture of it. If they weren't, if their team hadn't won it, they do not touch it. That's just bad luck. Little hoisting the cup, as you can see, I took it to my office and I thought, I'm going to have to at least operate on it, at least get a picture as if I was operating on it. So I put it in our little minor surgery room and operated on it. Took it to my daughter's school at Berkeley. It was interesting because unlike other trophies, Berkeley wanted to put this around it, the coordinate off, and put it behind so that the students couldn't touch it. It was interesting because when they started to do that, I went over to the keeper and I said, we have to do, they said, no, this cup is meant to be touched. And so if somebody wants to go up to the cup and touch it, they can touch it. They're not allowed to hoist it. They can't hoist it, but they're allowed to touch it. So we took that away, let them walk behind it, and some of them wanted to take pictures of it. But anybody that wanted to touch the cup was allowed, and that's just part of the nuance of the cup and its history. I got a ring. There's the 2004 Stanley Cup ring. There were I think 108 diamonds, 106 diamonds, because there were 106 points. One represented each of the points of the that they got during the season. And of course, one side had each of the teams defeated during the championship and the record of the team. The other one had my name on it and just Stanley Cup champion. And on this ring, it said doctor. It put a DR here and Slonim up here. The 2020 Cup was different because it was in a bubble. So we really didn't get to have the time on ice. But when they did bring the cup to the arena, of course, there were no fans in the arena. That's when I had the opportunity to hoist the cup after the 2020 win last year. So at least I had that, that one opportunity to be on ice and do it.
Were you in the bubble, Chuck, or
no? None of the docks from Tampa went into the bubble. None of the usual docks, the orthopedics or the medical docks. It was tough because they weren't able to determine how they were going to pay the docks because it was going to be 58 days, 56 days in the bubble. How are they going to take care of their offices? They all had private practices. One of the ER docs from Tampa General, and about a few years ago, typically the 4 docs that were used was ortho, internal medicine, dentist, and eyes. And those are the 4 of us that were always at games, and we had to be. Because of some of the controversies up in Canada, not all the arenas are near an ER or close to an ER. And as you know, there have been some instances of carotid lacerations with skates. There have been all sorts of neurologic problems that have occurred, even cardiac problems that have occurred. And they thought that without some of the Canadian hospitals or stadiums being near, they wanted to make sure that one of the new requirements was that an ER board certified ER doc be on the ice. In fact, they have to be the doc next to the bench, the closest to coming off the ice. And that became a new rule. One of the ER docs that was going on a locum tenens from Tampa General, Elise Zahn, went into the bubble, and the bubble wasn't easy. They had to stay in their hotel. They couldn't leave the hotel room. They ate with the group in the hotel. the arena was across a parking lot, or in some cases across directly across from the hotel. So the only place they could go, they couldn't visit the city. She had to go directly to the arena for the games and directly back to the hotel for 58 straight days. Had to stay in the hotel, could not leave. That was just the rule of the bubble. And of course, it was very successful because when it came to the teams that were in the bubble, very few ended up experiencing a COVID experience, and so the protection was really good. So I was not in the bubble, and although I would sometimes, they would send pictures and I would say how to sew them up. As you know, I'm the cut man because of my oculoplastics. I'm the one that sews all the players up. Both teams, we take care of both teams during this regular season. We take care of the opposing team as well. During playoffs, we do not. You travel with the team because you're in a series of 7 games. You don't want the other team to know what your injury is, where other players could take advantage of that knowledge. So you usually bring your own doc. Yeah, if you need an X-ray, the X-ray may be known to everybody because it shows up on both locker rooms teams, but in their on the computers. But for the most part, that's the you travel with the team during the playoffs, and I've been fortunate to travel just as the cut man. You usually don't need an eye guy, but we want the players back on the ice as fast as possible. And ortho or general don't want to sew the players up. They leave that up to me. The picture you see over here is when I had the cup. They were I got it again, and I had it put it on my dock. But this is during COVID. So we had, and there's one of the keepers is right there. And when the person that was traveling with the group that was taking the cup around in the Lightning van was there as well. And so this is my dock, as you can see, but I had people come in. I had a sign on the front door that said, "Go to the right to enter." Everybody has to wear a mask except when you take a picture. Then you go on, take your picture, and then walk out the other gate on the other side of my house. So it was sort of a COVID friendly, if you will, scenario. One of the interesting things was that when I had the cup in 2004, one of our neighbors and friends of ours, in fact, he was the Buccaneers, Buckaroo, the pirate, the mascot. His son was 1 month old, and he took a picture of his son in the cup while it was over at my house. And it turns out that when he was in line, his son was now 16 years old, and was going to take a picture with standing next to the cup, obviously not in the cup, but it was just ironic that 16 years later, from 2004 to 2020, the same person that took a picture in the cup was now next to the cup. Anyway, my daughter took the pictures. They handed her the camera, and she took a picture of everybody, my family, my daughter, son-in-law. And no, my name is not on the cup. The trainers are on the cup, and all the other people are on the cup. You can see Jeff Vinnick up here. So the 2020 as they are engraved in the cup.
Chuck, hasn't Tommy Mulligan's been with them the whole time, hasn't he?
Pardon me?
Tommy Mulligan, he's been with them.
No, he came in around 2003, 2002. So he's only been in. An interesting Ira Gutentag, who's our orthopedic surgeon and medical director. I brought him on. I brought on all the doctors. They always ask me, because I'm the old timer now and been there. If someone has to leave, who do you want? Who should we bring on? And I brought him in 2002. And Dave Leffers was with us from its inception, from 1991, but then left in 1999 or 2000, and so Ira gets it, and 2 years later gets a championship ring. So it was just luck of the draw.
Is he still with them?
No, Dave isn't with them anymore. Ira Gutentag is our
Oh,
chief
I meant Ira.
orthopedic. And here I brought it to the VA and just stood it outside my office door where I'm sitting now. And then hundreds of people across the street is our mental health department, and people came over. They knew it was there, and just to stand and take a picture and walk by. This year's ring was a lot different, a lot bigger. 500 diamonds, little chips of diamonds, I think 88 sapphires, designed, I think, by, well, not I think, by Mrs. Vinnick, Penny Vinnick, and she designed it. And there's a lot of history and a lot of um, uh, details to it that have some certain memories that exist. I won't go over each one. The other side, the distant thunder, just having that was to signify and pay homage to the fans that were never at the games, but because of COVID, but were the distant thunder. The top of the ring, there's my 2004 ring. There's the 2020 ring, and in the difference between my ring and the player's ring, there is a little difference. The player's ring, this pops up and rotates. And inside, it had Sweden, where the first game was played, where they played the first preseason game in Sweden. And so giving, again, homage there. And again, there's a lot of symbolism in it, a lot more diamonds, and a lot more expensive than this one was. And as you can see here, the old ring, it said Dr. Slonim. This one didn't. This one just said Slonim, but you can see the difference in size. And of course, that's that was the 2020. 2021, I don't have a lot of pictures regarding it. The picture that went, and Vazzy came off the ice. He gave me a hug because I was just standing in the doorway of the bench, and my phone blew up. I don't know how many people actually look at a TV and recognize somebody for a split second, but my phone blew up. Everybody started sending me this photo that was, I guess, on NBC or whatever it was. On the ice, with the cup at this year, here I am sitting here, but the cup sits on the ice, and of course, Jeff Vinnick is here, and players and other members of the team and hierarchy are on the ice. In the locker room immediately afterwards, you can see where Coach Cooper is, and of course Mr. Vinnick is here. And players, you can see that they cover a lot with plastic because of the flowing champagne. Everything gets squirted, and so as a result of that, there's a lot of plastic liners to protect clothes and everything else that they don't want to get wet with champagne or beer or whatever. But there's the picture inside the locker room, and the cup sitting on the floor here. And as you may or may not know, although I don't have a picture of the floor, on the floor is the emblem, the lightning bolt. You do not, no one ever walks across the bolt. You don't stand on the bolt, you don't walk on the bolt. You always walk around the bolt. And in this case, there's a piece of plastic on the bolt, but the players are actually sitting in the middle, and it's bad luck to step across the bolt during any time during the game. So it's something that is not done and part of the superstitions, of which I'll talk about in a second. But anyway, I'm waiting for this ring. I don't have it yet. I have one other ring, by the way. I have a lacrosse national championship ring when I was with Hopkins in my senior year. And so I have an NCAA championship ring, which is much smaller than all of these, but at least it has my name on it and says lacrosse on it. So from that's the missing area. So I've been over 1,000 games. I've put in more than 1,000 stitches, and I have 3 Stanley Cup rings. And one thing that David asked me about was, things like this. One of our players throwing stitches in and getting them back in the game. What's the difference between our players and what happens on the ice and what happens in real life is just this. In real life, they ask you for a week or 2 weeks off, and workman's comp and everything else. And by the way, the New York players get workman's comp. Workman's comp gives a stipend per stitch when you get stitches, just in real life, and they do get a compensation. I don't know what it is. I've never asked them in detail, but New York allows for compensation, so it's always, can you put more stitches in, Doc? All the players know how many. They want to know how many on the inside and the outside. They're very cognizant and aware of it. And of course, if you did this in between periods, which is what I do, is in between periods, or if it's bleeding profusely, I may throw a couple stitches in, stop the bleeding, and put them back on the ice and finish it at the rest of the game, which I don't like to do because then I have to stay later than the 10:30, 11 o'clock. But the goal is to get them in quickly, and get them back on the ice, because that's the first thing they want to do, is get back on the ice. Sometimes they're trying to get off the ice or get off the table while I'm putting the stitch in, and telling me that they'll come back later to get the other stitches in, or for me to expect whoever punched them to be in, and then I'm going to have to sew them up because they're planning to get even. And usually that happens. They'll do another round of fighting on a face-off and drop their gloves and go back into fight. But this is these are things that you would not do in private practice. You would not tell them to go right back to work, or within minutes go back on the ice and complete it. But that's the type of players that these guys are.
Do they get sewn up without anesthesia? Or
many years ago, 30 years ago, most of the Eastern Bloc countries, the Polish, the Czechs, the Russians specifically, did not want anesthesia. And I learned later that there was a fear because the Russians were used to Russian army doctors that would reuse needles. They'd re-sterilize them, but they would reuse them, and because they didn't have disposable needles. So they were always afraid of them, and they didn't want to use the same needle. But most of them would go without. What's his name? The tall guy that from the Boston Bruins.
Zadaro.
Yeah. I'm blocking his name. I had to put 19 stitches in his. I had to put 19 stitches in his thigh from a skate injury. Didn't want anesthesia. A lot of times, if it's a single stitch, I'll take an ice cube and I'll put an ice cube on an area, an eyelid, a brow, a cheek, and throw a stitch in. If it's only 2 or 3, I'll tell them, look, if I hit you with the vessel, it's going to swell. May close your lid. So let me do it without. But most of the time, I'll give them a little 2% width, obviously not in a finger or in a. I won't use epinephrine on a finger block, or sometimes the tip of the nose I might or might not. But everywhere else, a little 2% width is about it. Maybe some marking width, but the goal is in and out ASAP. So that you can expect. Now, what I did not expect was this. The celebration of the, after the boat parade, one of Killorn's friends that were having a good time that day, he didn't realize that he fell in his house and opened up a brow laceration all the way across the brow. Killorn was mad because he got blood all over the carpet, all over a bed. He didn't even know it. He doesn't remember it. Killorn called me, or the trainer called me, because Killorn called the trainer and said, is there any way that Dr. Slonim can come over to my house and sew up my friend? So here I am. Here's his friend from Canada on the dining room table at Killorn's house. Killorn taking a picture, and I'm sewing this guy up the day after the boat parade here in Tampa. So it doesn't go past. It doesn't always happen in the locker room. Sometimes it's house calls, as you may expect. And in that case, I think it was 9 or 10 stitches at Killorn's house on his dining room table. We just cleared the table. And after, by the way, with what's his name, Cooch's interview about Bud Light, there was a whole wall of Bud Light that was shipped over to his house for his friends that were out there. Another interesting phenomenon. I went out back. He had 6 friends over from friendship that he had from everywhere. All of a sudden, when I went over to Kaloran's house, I was met at the door by a young woman who had a backpack. And I said, "Whoa, who are you?" She said, "Oh, I'm a registered nurse." I said, "Are you here for the suturing?" And she said, "No, I'm here to with a company called Refresh, which does local IVs." And so she was here to give 6 IVs. Now, I didn't take a picture of it. I would have loved to. But when I was finished sewing up, I went around to the back door, the glass sliding door, and here are 6 guys, burly guys, sitting around the swimming pool, still drinking whatever they're drinking, but each one had an IV in his arm, getting lactated ringers to replenish their dehydration of the night before. So she was making house calls to a lot of places because they know that that exists. It's not uncommon after coming off the ice that some of the players will get an IV because they require it. They were just completely dehydrated and just can't take it orally. So that's not uncommon. Really more during the playoffs than during the regular season. EMS will come. The docs will start the IV sometimes, but we like when the EMS comes in and does it. I've started a couple IVs and actually not too bad at it. I haven't blown one yet, but EMS will do it. Don't think that the game that we're immune also, because here I am. I took a puck to the head that came over the ice. The goalie that was sitting on the bench didn't reach out for it, came over top of the glass and hit me in the head. I have a permanent dent there now that you can see right here, probably from some fat necrosis there. Luckily, didn't need any stitches. Went into the locker room, put ice on it while the game was going on above me. So there I am sitting, taking it. The team gave me a helmet and signed the helmet. But that wasn't the only time. A puck came over the ice and it was about to hit my wife in the face, who was sitting next to me like a dummy. Luckily, I didn't break anything. I put my hand out and you can see it smacked my hand, but protected her, as every husband should do to their spousal unit. And but I took it in the hand, but didn't break anything. So from the standpoint of what's the big difference, what's the difference between private practice docs and professional docs, I'll tell you a couple stories with just a few more minutes and leave it open to questions. A couple interesting stories. One that's specific to me during the 2004 playoffs, and Moira, who I know is, I think she's still on.
Yep.
I can attest to this. One of our players had developed a corneal ulcer. He slept in his contact lens. It's during the playoffs. One of the rules of thumb, you never wear a contact lens when you have a corneal ulcer, a bacterial corneal ulcer. I'm treating it with aggressive antibiotics, making him wear his glasses, but he needs to practice. He needs to be in the game. I am on record in the literature, in the ophthalmic literature, about microbial keratitis, corneal infections and corneal ulcers, and contact lenses. I'm in the literature as saying it is something that you would never do. It's malpractice. I didn't say the word malpractice in the journal articles, but that it is not to be done, that it is a contraindication. And the minute you see a corneal ulcer, you take the contact lens off. Moira will attest to that. Here, I have a player with a corneal ulcer, mid-periphery, that could end up perforating the cornea, blinding the patient, and during the games, I'm allowing him to wear his contact lens, but immediately taking him out, putting a drop of a topical anesthetic on the eye, which only lasts 20 minutes at a time, which is also medical malpractice, in order that he doesn't feel his lid or the contact lens while he has a corneal ulcer and exposed corneal nerves. Something that one would never do, that I couldn't talk my way out of a malpractice suit. I would just go up to the judge and say, I am guilty, because I know the opposing attorney has my articles that they're going to use against me, and that's all there is to it. Things that we would do, we would never do in private practice, that we do in professional sports as a result. I won't say which doc specifically, but a player with injuries to the lower thumb because of a non-displaced fracture, during game time, giving Marcaine injections in order for the player to be able to play and utilize his hand and his wrist and his finger and gripping the stick, which couldn't be done as long as he had pain there. It's not uncommon to give blocks. It's not uncommon to give Toradol shots. Sometimes 4 or 5 players will line up, usually not during the main season. If it's an important game, possibly, but they may want some Toradol in order to relieve some pain that they're having, that'll get them through the game. Blocking local blocks to allow a player to be able to be comfortable during the game is not uncommon, especially during playoffs, to make sure that they're able to play. The players will typically insist on it. The docs will be very reticent to do these sort of things, because the possible consequences of multiple injections during every game, 7-game series, 4 playoff games, getting a shot 28 times or 20 times during a playoff bout, something you would never do. In the place of Killorn, most of you may or may not know, he had a non-displaced spiral fracture of the fibula. Wanted to get back in the game. That was early in the not early in the season, in the final series, but wanted to get back in the game. That was on a Tuesday, I believe. Wednesday, he was starting to talk about maybe having surgery. There was a one surgeon that wanted to do a external pinning. Then the question was, should it be an external pinning or should it be a rod? The rod will get him back in the game sooner. So they decided to put a rod in. They were going to send him by private plane. He came back from Canada and by private plane to try to have the surgery and then fly back up. Unfortunately, the swelling in his ankle was just a little bit too much to get into the skate. The question was, well, now he's got a pin. He's trying to skate. He's on the ice 2 days after having a pin in his placed in his ankle surgically, but his swelling just would not come down. Therefore, he didn't. But if you notice, he was on the ice to hoist the cup with the team on his skates 5 days after having a pin put in his fibula in order to try to help a fracture and get back in the game. As you know, in private practice, your patient would have wanted the week off, if not the 6 weeks off, workman's comp probably, whatever the case. Here, he said, no, I have to be in the game. I have to be on the ice during the final game. Every effort was made to do that, but it did not happen. Unfortunately, he was saddened by that. I can tell you, he wanted to be in that game. He was gladdened that he could put both skates on and hoist the cup and be in that position. So that's David.
He actually skated warm-ups for one.
Yes, he was skating. He was skating warm-ups. It just the swelling was just a little bit too much. But that was 2 days after the pin was put in.
And then Kucherov got rib injections, didn't he?
And Kucherov got rib injections, long-acting anesthetic to last the game. He had a fractured number 10, but insisted on playing. But the only way he could play with rib protection was to get injections in the rib before every game. Again, not something we would do in private practice, no matter what the patient told you. I need to go back to work to do this. Well, I'm going to give you a long-acting injection in the fractured area so that you can go back to work. It's not going to happen. It's a little different in professional sports where the docs do things that you wouldn't do in private practice. The only other thing I might say is there are a lot of idiosyncrasies and superstitions that take place in the locker room, taking the tape off of their sticks and retaping them in between every every period. The number of times that you wrap a stick, the same number of times, the same count that is done. Balling up the tape, what's left, to throwing it away. If you miss the waste paper basket, no one else can take throw it in there for you. That the player has to go grab the tape and throw it away himself. Certain things in the locker room, certain players will want the same person to throw the protein bar to them. Can't be somebody different, even if the person isn't. We call out for them. Ice towels dipped in ice water thrown over the head. Once I almost got in trouble because I was bringing the ice because I knew the other person that normally does it wasn't there, but the player allowed it to happen. Luckily, he scored. Therefore, I had to give him the towel every time afterwards. So when something happens good and you're you happen to be in the position that happened just beforehand, you become part of the superstition and part of the process.
And nothing stopped them from touching the conference cup.
Conference cups, you don't clutch, you don't touch, because but at certain time, this was a different story, but usually you will not clutch a conference cup until you've won the Stanley Cup. It's just bad luck to tell you that you won and to brag about winning something if you haven't won the final trophy. So there are things about that. Taking photos with it was a different story where everybody took a photo of it. Not too many people touched it, but it's again, and back to reminds me because Stammer was there, thoracic outlet syndrome, fracture of an ankle, of a leg, all of these things that take place. These players, don't stay out. They go back in, and they want to go back in. Getting stitched up. The most stitches I put in somebody to put him back in the game was Cullimore. He will say that I put in 96 stitches. I sort of remember 93, but whatever, I'll go with his 96 and then put him right back in the game. And that was a facial laceration from a skate. Skates cut just like a scalpel does. It's a nice laceration. Fist, sticks, and pucks and the boards don't cut as nicely. More stellate, more complicated, but nonetheless, the goal is to get him back in the game.
Chuck, what was Hedman's injury at the last part of the season? He said he was playing somewhat injured. A foot?
Oh, it was an ankle. It was an ankle. He had just tweaked his ankle, and that was the problem with him.
Does he need surgery?
No, he did not. But it was hurting enough that he just couldn't put pressure on it, and then with some rehab, and rehab includes acupuncture with electrodes, all sorts of things. We have physical therapists, we have massage therapists, we have strength and conditioning coaches. We have everything we have chiropractor, we have everything at our fingertips, and the players will utilize it. And sometimes it's just laying on the hands, as you all know. It may not have any physical effect on the injury, but the laying of the hands can sometimes be all that is needed. And likewise. And I think it's 10 minutes of one. I didn't think I'd be able to talk this long without clearing, and I hope that was of interest to you all. I hope I didn't brag too much, and I hope I didn't say too much more than I needed to say, but I appreciate you all at least hanging around and listening. It's nice to see you all as well.
Chuck, can you take your screen off and we can put
Yeah.
everybody up there? And then if
I will
I think we
stop
lost.
sharing here.
There you go. Yeah,
Oh, I should have included, by the way, that Ron would have backed me up when it came to corneal ulcers, contact lenses. I'm sure he would have been on my rear end for throwing any patient in a contact lens and a corneal ulcer. There's no question about it. He would have taught everybody that it was in his office, you never do that, and that is malpractice and beyond. So I know he knows that as well.
But what if he would have said to the player, "You can't play"? Where would that have gone?
That's an interesting scenario because you bring it up. The first person I tell is the trainer. The trainer may or may not tell the player. I will tell the player, you can't do that. You can't wear your contact lens. Doc, I have to wear my contact lens. I can't play without my contact lens. How do I wear my contact lens? Then I start, then the rusty, as old as this gray hair covers the rust of the wheels up top. Is it possible? Is it something that I could potentially do and not get in trouble? Because in this case, it's blindness and it could be a career. In any case, it could be orthopedic and it could be a career. Can I do it? You try it for a day. It worked. They promised to take it out. I make sure they take it out. They put their glasses on. I look at the ulcer. It didn't get worse. They come back into the next practice. They put it in. They take it out immediately after the practice. They're putting in the antibiotic drops, more than I normally would use. You do it until you think you're going to get burned. And if you get burned, you say, no, you can't play. And then also remember, there are sometimes the burden is taken off the the orthopedic surgeon or the internist, more the orthopedic surgeon, because the who are the guys that take their professional I'm blocking on the term, I'm sorry, they're agents. Every agent knows and every player knows who the doctors are with the reputations across the country. There are upper body soft tissue experts. There are lower body soft tissue experts. There are shoulder experts. There are left knee experts. There are right knee experts. These experts are all over the place. There are mid body, there are hernia experts. So a lot of times, when our surgeons would just say, I just as soon not operate on this guy. It's always, we're going to send, the agent is going to suggest sending the player to the soft tissue expert in Iowa City. They'll go there. The problem is they may do exactly what was done here, but they have the expertise. The problem is that they will want us to do the rehab under their guidelines, even though it may be against what we would normally do and may even slow the process down. They will listen to what they say, and it's their guidelines until the player is dissatisfied. And when the player is dissatisfied, then it's done for. Then he'll go to our doctors. But there are all these experts. And one last story in the last minute that it just reminded me of. We had a player that was out with a fractured ankle, had a 6-week out. It was early on in the season. So I won't tell you the player's name. Nice kid. But it was at the end of the season. The last game was going to be in the 5th to 6th week. We had a very losing season in one of the first few weeks of the year, of our season. I was in the locker room, and at the time, one of the orthopedic surgeons that was there, not one of the long timers, but one of the orthopedic surgeons that was an interim orthopedic surgeon before I brought in a couple of the others, had said, the player asked the orthopedic surgeon, at the 5th week, about the 4.5 to 5th week, he was out of his cast. Can I go back in the game? the orthopedic surgeon said, look, there's only one more week of the season. Why torment yourself? Why go back in the game? The season is a losing season. There's no reason to go back in. The coach at the time had walked by the open locker room door, the training room door, overheard the conversation. By the end of the next period, the trainer came up to me and said, Doc, we have to find another orthopedic surgeon. I said, what are you talking about? He told me the conversation that the coach heard. That's all it was. That's all it took. Done. Over. Had to find another orthopedic surgeon. So again, it's sports medicine. You're only as good until you make a mistake with a player or a player's family member, and then it gets back and your history. I've just been lucky.
Boy, it's a tribute for you to have been there that long and just make the decisions that you've made. Anybody else have quick questions for Chuck before he goes?
Got to go back and see patients, but absolutely open to any.
Well, it goes without saying, Chuck, that you, with your wealth of experience, there's a book there. There's a book.
I thought about it. The problem was, and I tell everybody, the new guys, look at the idiosyncrasies and write them down. I've seen hundreds of players that I wish, Marty St. Louis he'd had to throw a little piece of tape, but it had to bounce off the wall, had to be a bank shot, and if it wasn't, he had to go back and pick it up and throw it again. It's all these little things. My memory just doesn't recall all the idiosyncrasies, but you're right, Bob. I should have jotted down a lot of this stuff. Who knows, might be one in the future when I'm gone. And just, you never know.
I'll proofread it for you.
Yeah, thanks.
Interesting talking about the players that wear contacts. Since I hear a lot of stories from my son, who's a refractive surgeon, he treats a lot of athletes who have 20/20 vision, who want 20/15 vision, and they will, sometimes with LASIK, sometimes with lens exchange type of thing. Why would they wear contacts when they could have something like that?
Well, because during with LASIK surgery, there is a potential to knock the flap off. In LASIK surgery, as you know, a small flap of cornea is raised. The cornea is about a 0.5 millimeter thick in the center. You raise about 140, 150 micron flap, and then you laser the stromal bed, and then you lay the flap down. It is not sewn into place. All you have is an epithelial rim. In trauma, that could be lifted. And as Ron would know, as Moore would know, flaps have lifted accidentally and in trauma. Yes, a lot of the players have had LASIK. They will wear visors. Now visors are becoming an absolute. They never used to wear them. You were considered you couldn't be a fighter if you had a visor on, because you'd cut your hand on the visor when you took the first hit on the person if they kept their helmet on. So there is that potential. The other potential is the healing process. It could be a 6-week or 6-month healing process that you're not going to be allowed to go into contact sports. And of course, you have to coincide it. If your season is over early because you're not in a playoff, you might choose to do it so you'd be ready by October or August, September, October, when the season starts. That's the reason for it. Players do like it, but then again, the potential that the LASIK doesn't turn out to be a 2015 or 2020, or there is a complication, which is rare but possible, could be a career-ending phenomenon.
Anything else? Well, we've had docs we had Byron Moran from the Bucks. He came on, Chuck, a few weeks ago and talked about the Super Bowl win, and I want to thank you for discussing. It was fat. I love that stuff. I mean, it's what I live for. So I want to thank you again for coming on.
Thank you.
And maybe after next year we'll do it again. Have a three-peat.
At least I'll have a well, then I'll have the three-peat. Then I'll have a 4th ring.